Amazing. Thank you so much, Eva, for that lovely introduction. Okay, so thank you so much, everyone, for coming. Oh, I think somebody's, if maybe you can put on mute. Perfect. Thank you so much. All right. Well, welcome to, hopefully, trying to, oh, my bad. Welcome to today's presentation. So as it was already mentioned, I will be talking about empowering individuals for sustainable healthcare in mental health. My name is Jenny Okolo, and I am an occupational therapist. And I'll go into a bit more detail about what I do and a bit more about my experience as well. So like I said, I am an OT by background. I've been qualified for a couple of years now, maybe going about 6 years. And I've mainly worked in mental health settings, a variety of different settings, which include forensics, working in the community, in prison, and also various inpatient settings as well. So I've moved around quite a lot. Currently, I am working as a clinical assessor within complex care, which is slightly different to occupational therapy, but also still encompasses some of the same values and some of the transferable skills as well. So as a clinical assessor, we're looking at different aspects of, placements and supporting people with step downs in the community. I'm also the founder of SASA Health and Sensory. So it's an organization that I founded where we do workshops and talks on neurodiversity and various mental health topics as well. So that's a very short snapshot about what I do. So looking at definitions, I thought it would be, I always think it's good to sort of remind ourselves some of the definitions of the key things that we'll be talking about today. So first of all, mental health, as we all know, refers to the state of well-being in which an individual realizes their own abilities, can cope with the normal stresses of life, and can work productively, and is able to make a contribution to their community. And then sustainability refers to meeting the needs of the present without compromising the ability of future generations to meet their own needs. It involves environmental, social, economic factors to ensure long-term well-being for both the people and the planet. So the purpose of this presentation is to explore sustainability principles and how it feeds into mental health practice. How does it feed into the practice as occupational therapists? Because as we know, we look at an individual holistically. And it is important to empower people, our clients specifically, to be sustainable in different areas of their lives. So the intersection between mental health and sustainability. So as I've already mentioned before, mental health and sustainability are interconnected because of environmental, social, and economic factors that can impact well-being. Green spaces, exposure to pollution, climate change can also make a significant impact on one's mental health. So again, they are all interlinked. But that also includes a support network. So support network in terms of being able to go outside and interact with people, allowing our patients or clients the opportunity to attend groups in the community, to basically encourage people to have that community cohesion. Access to healthcare services as well is really important in that aspect as well. So being able to access services that better their mental health, but also their physical health too. There is also a link between income inequality and sustainability within mental health as well. So looking at people who might come from a variety of different income backgrounds and the access that they are able to have in regards to that. Employment opportunities and education are all different factors which we will also explore as well. So these are all of the things that we would be looking at as occupational therapists on a daily basis, actually, without actually knowing that this actually links in with sustainability. So, of course, it's always important to make sure that a lot of the work that we do is evidence-based. There is evidence, lots of evidence-based research papers out there. So I've just put a couple here that can be found online. Um, and it mainly looks at the links between physical and mental health and how the nature and environment has many therapeutic impacts. And there is evidence to show that this can actually be a good and positive intervention for the people that we work with. Um, so how can OTs contribute to sustainable healthcare in mental health practice? So there are five principles which can be found on the World Federation of Occupational Therapists. And just going through them very briefly. The first one looks at understanding sustainability. So OTs are encouraged to educate themselves about the ecosystem, um, the issues of the ecosystem and how it impacts the ability to pursue meaningful occupations. So again, some of these keywords that we're already using in practice is really helpful for us to make sure that we put at the forefront. Principle two, the role of exploring sustainable lifestyles. So it's working with our service users to explore meaningful occupations in a way that contributes towards the mitigation of environmental damage. So just making sure that the lifestyle that they are engaging in, whether that's in a community, whether that's inpatient, whichever setting, is making a positive contribution. And again, we'll look at a few examples later on as well. And then principle three is adapting to environmental damage. So working with service users to help them understand some of the damage that can be caused by, everyone, whether that's consciously or subconsciously. And it's just helping them to understand the contribution that they can make or that they are currently making to ensure that they are sort of actively being proactive in making sure that they are being sustainable in a way as well. And then number four is empowering community sustainability. So again, just looking at the group work, spreading awareness, empowering communities to advocate for sustainability. And that mainly starts with education. We don't know what we don't know. And that goes the same for us as practitioners as well. So in order for us to teach our service users and the client group that we work with, we also need to be able to educate ourselves in sustainability or other areas that we are trying to support our service users with. And then just the final one is looking at our professional competence as well when addressing occupation-based interventions to address sustainability issues. So just making sure that we are, again, going on courses, educating ourselves, using and evaluating tools that are maybe already out there, being part of developing new tools and protocols as well. So those are some of the guides that you can use to enable your practice to be more sustainable. So picking on from that, I've been able to pick out a few things in my own practice, but also how we just generally as AHP can contribute to sustainable healthcare in mental health practice. So the first one, as I've already mentioned, is having a holistic approach. So we as OTs, we already tend to do that quite naturally, having a holistic approach, looking at not just the physical aspect, but the mental health aspect, the social aspect, the emotional side as well. And addressing those multifaceted factors can promote sustainability and improvements in those mental health outcomes. Empowerment, and self-care management. So supporting people to be more self-aware and supporting them with their self-management is also key to our mental health practice. Environmental intervention. So I'll go on to provide you some examples of what we as OTs or AHPs can do outside in terms of our interventions. promoting participation and inclusion. So it's not just about telling our self-service users what to do or implementing things. We need to be able to work collaboratively and involve our service users in any of those decisions that we are making. So that could be from when we're writing our policies, when we're, you know, organizing our groups or introducing new groups. So again, that links in with collaboration and advocacy as well. So being able to advocate for our service users as well. So some of the examples of sustainable mental health projects you might already be using in your practice already, but these are some of the things that I've been able to be involved in. So horticulture is really popular. It has so many benefits outside of just sustainability, but actually just mentally for the service user. So looking at meaningful occupations, looking at some of the skills that we're able to assess during this period, whether that's being able to implement that in a routine. So we have a lot of service users who maybe aren't coming out of their bedrooms that much or don't have a structured routine. So being able to create something that's meaningful that they're able to see through till the end and be involved in is also really good too. Walking groups as well is also part of that sustainability. So being outdoors and encouraging outdoor activities. So we have walking groups, we also have groups to do with sports as well. So being as creative as possible, I would say, is quite important in our role as OTs. So I wanted to just, before I play this video, share a quick story of a restorative justice program that I was a part of when I was working in a forensic setting. So this was a medium and low secure setting that I was working in. And this is something that I'll forever remember because of what it taught myself and also the impact that I saw it had on our service users. So we, again, when we're talking about collaboration, we were making changes to the therapeutic program, and we asked our service users what is it that they wanted to get involved in. So we had a list of things that we brought towards them, and they actually picked out that they wanted to learn how to fix bikes. So again, being able to link in their meaningful interest and occupations with, what is also sustainable in terms of, our creativity in thinking, okay, we have scraps of material and bikes that have just been left to the side. What can we do to encourage our service users to be involved in learning a new skill, but also at the same time be sustainable as well? So what we did was, what my managers did at the time was they sent us out on a course to do a bike mechanic course, which again, it's not something I have expected I would do. So I was also open to learning something new myself. And the purpose of this was for us to do the training and then come back to the ward and train our service users and teach them how to restore bikes effectively, so that those bikes could then be sent back to the community, whether that's to schools, to charities that we could donate to. So it was a full circle moment that occurred. So I'm just going to play an example of something similar that we did, and just to show you the impact that it had and how it can also contribute to sustainable practice in mental health. So hopefully this will play out loud.
Jenny, we can't
There's
hear
no sound.
it.
You can't hear it?
No, and I think you might need to if you stop sharing and then before you share it, before you turn it on, you have to click a button that says share sound.
I see. Okay, sorry about that. Thanks for letting me know. So I'll share it again, hopefully with the sound.
You found the
Oh yes, I've seen it just now. Yeah.
and okay.
Sorry?
No, it's also your screen is not on presenter mode at the moment. It's we can see all the bits around the slide. That's all.
Ah, oh.
Okay.
Oh goodness.
That's okay.
Okay, I'm not very tech savvy, so let me see if I can. Is that okay?
Once we get back to the workshop, basically we put the bikes through an inspection. What we'll do is we'll get the bikes round, get them on the stand, and the guys that have been fully trained after the first 2 days will then take those bikes, strip them down and see what damage there is to them and what is needed to repair them. They will then, from there, start working on the bikes to get them up to the standard that is required for them to go back out the workshop and safely onto the road.
The concept of the bike workshop came about as part of developments, a whole load of developments for restorative justice as part of community payback orders. We had discussions with staff and service users as to what kind of things that we could take forward. So the bike workshop was seen as one that would be worthwhile for service users to learn new skills. In years gone by, that was one of the biggest things we did was litter picking. That has developed, but I think the bike workshop is a very specific thing that we're able to pay back in a different way, and they can learn new skills at the same time.
Once the bikes are completed, they'll normally go from here to various primary schools around North Lanarkshire. The lads absolutely love it. They're delighted with it. They actually get to see the bikes coming in from the start. They inspect them, they repair them, they get them checked on the way out, and then they deliver them to the schools. And you'll never see a happier bunch of guys than that day.
This partnership's been fantastic for St Thomas's Primary School. We've managed to have our outdoor space, and now we're getting the use of cycles for our bikeability training. Honestly, the children are really excited about getting these bikes. You're going to see just in a minute how excited they are. Some of the children don't have their own bikes, so it's a really good opportunity for them to have a wee shop on these bikes today.
I think this is a fantastic partnership that St Thomas's have entered into today with Restorative Justice. As you can see behind me, the young people are thoroughly enjoying their new bikes. I think this is a very important programme, and we'll see incredible benefits here in this school, and hopefully if we can roll it out in other areas of North Lanarkshire.
Okay.
As part of the bike workshop,
There we go. So this is So like I said, this is a great example of an activity that OTs can get involved in creating something that's meaningful, but also creative, and also something where our service users could learn a skill. So actually something I forgot to mention was that every single service user that was involved in this project received a certificate, an accredited certificate that they could then go on to put on their CV, on their portfolio, and that also in turn helped us and helped them in when they were ready to go into the community and integrate back into vocational work, for example. So it kind of had a really positive domino effect in all aspects of not just the service users' life, but also for us as well, in terms of maintaining that sustainability aspect and getting our service users involved in that area as well. So the key thing is to sort of make sure that you are being as creative as possible and to find little areas within what you're already doing to see how you could make your practice or your group or your program more sustainable. So what I'd like to do, just very quickly, is to just get you to think about one aspect of your practice or a group or a session that you've done that you think you could make more sustainable, or that you have done in the past, now that you've sort of heard and seen a few examples. So if you just pop them in the chat, and then we can discuss them, later on at the end, where we'll have a Q&A and be able to explore them in a bit more detail. Okay, so just for time purposes as well. So like I said, we can discuss them at the end. So whilst it's great, some of the things that I've mentioned and some of the examples that I've shown in terms of addressing how we can be more sustainable within mental health and within our roles as OTs, as AHPs, it's also important to note some of the barriers that we can face as professionals, but also barriers that our service users could also face as well. So, so for example, financial constraints. So whilst there are a lot of projects which are up and running, some projects I understand take a bit of time because of funding. So that's something that could be a potential barrier as well. Limited access to services as well. So whether that's to do with distance, whether that's to do with like I said, when I worked in forensics, for example, there were some restrictions in terms of which service users could access services, whether that was to do with risk. So if we take the example of the bike recycling group that we had, there were some concerns around the tools that were used, for example, right? So we had to really risk assess, which service users could utilize some of those tools and implement that in their care plan and work towards that goal as well. So even though there were these barriers, it didn't mean that this was the end and they could never engage in such a group, but it was a chance for us as OTs, for us as a team, as an MDT, to think about how can we help this particular person reach that goal. And if there is that barrier, let's put that in the care plan and work as a team for them to get to that point. Stigma and discrimination as well. So again, within mental health, there is that stigma and discrimination just generally as well. And that could be demotivational for a lot of our service users. And again, we're working with people who might have been in the system for a long time. And if you're working in forensics, on top of that is that added stigma of being in the criminal justice system that could either stop them or prevent them from engaging in meaningful activities such as some of the projects that involve sustainability. So it's also important to bear that in mind. Workforce shortages. So looking at staffing, I think we all know that staffing can be an issue as well. So during this project, I wasn't doing it on my own. We had OTAs, we had HCAs, nurses as well, and we were lucky in that sense. But I understand sometimes it's quite difficult to put on as many groups as possible that involve sustainability, that involve going out as well. Policy and regulatory barriers. So sometimes policies can be outdated. So it's important to keep updating it because we're always learning and we're always trying to find new ways of working. And like I mentioned in my earlier slides, it's important to get the service users involved in some of those policy making as well. And then just in general, the fragmented healthcare system. So just bearing that in mind and just making sure that we are being as creative as possible, which is one of our strengths, one of our many strengths as OTs. So looking at some of the strategies and recommendations, we spoke about financial constraints. So there's funding opportunities. So within the local council and within the NHS actually as well, there are some funding opportunities. And actually also, so how this came about, this particular project with the bike recycling and bike mechanic training, we spoke to a lot of we spoke to our managers and we had a lot of meetings about, what can we do to support our service users as creatively as possible. So actually speaking to some of the senior managers as well. Looking at this discrimination and stigma. So looking at educational campaigns, raising awareness in our groups, in our one-to-one sessions, engaging in community outreach. So I did a lot of link work with community outreach in the local area and speaking to them and seeing how they could also work with us. And also challenging misconceptions as well, because some people do have misconceptions, for example, around those who might be involved or have had involvement within the criminal justice system. So it's having that open dialogue that I think is quite important. So when talking about limited access to services, so ensuring that there is that accessibility there available. So whether that's to do with telehealth or digital ways of working. So we know that a lot of courses are now on Teams, bringing in some of those services into the units, for example. We did a lot of that too for people who maybe couldn't go out. So maybe they've got leave restrictions or, whatnot. And like I said, collaborating with organizations and leaders to address some of the other barriers, such as cultural and linguistic barriers. And then again, when looking at the fragmented healthcare system, so advocating for integrated care models, prioritizing holistic approaches, facilitating communication and collaboration, and things like that. Workforce shortages, so investing in workforce programs, in terms of recruitment as well. So as OTs, so we also have quite a wide range of skills actually, but also to support some of those initiatives to further those conversations around some of the groups that we might be doing and the link work that we're doing in the community as well. Fostering partnerships as well with academic institutions, but actually I forgot to add also with some of the other institutions. So a lot of companies as well who are now more open and willing to engage with our service users, and it helps to create a bridge between, let's say, for example, the inpatient and the community. So we have that positive relationship there. And then policy, so advocating for policy changes, having evidence-based support as well. So like I said at the beginning, we need more evidence-based material that we can use to actually advocate for this. So there's been a lot of projects, and there's one that I was reading earlier on when I was preparing for this, a project that was done within Maudsley Hospital, South London and Maudsley, where they did a project to do with gardening and encouraging service users to do gardening in different communities and actually teaching them and enabling them to get jobs out of that as well. So I think that's also quite important. So some of the key takeaways that we've sort of discussed. So the intersection of sustainability and mental health care, the importance of addressing environmental, social and economic factors in promoting well-being. So looking at everything holistically, because it's not just one part, it's actually everything. AHPs and OTs play a vital role in integrating sustainability into mental health practice. So integrating it into what you're already doing. Yes, we can make all these changes, but we are already doing quite a good job. A lot of us OTs, it doesn't matter what setting you're working in. So it's more about just integrating some of those practices in what you're already doing. Also, we looked at how sustainable practices can positively impact individuals' mental health and well-being and vocational well-being while contributing to environmental sustainability. So we're looking at, how this could work outside in the community as well. And then also some of those meaningful activities that I've mentioned, such as gardening, bike repair. There's also food as well. So maybe looking at healthy living. So some people might have healthy living groups. I know I did at the time. Can also empower individuals to foster, sustainability, connection, and promote environmental stewardship. So those are some of the key takeaways I'd love you to be able to take away from this. And this marks the end of the presentation. Sorry, that's a bit rushed, but I was looking at time. And I can already see there's been a lot of chat in the chat. So I'm happy to take in any questions or any comments as well regarding this. So thank you very much. So let me have a look at the chat.